Okay, can you see clearly? All can see slides?
Yes, Doc, can.
Yeah, good. Okay, very good morning today. And today our topic is under the wound management and solution with ganotherapy. And today we discuss on these issues because a lot of people, when they have a wound, any kind of wound, there's so many kinds of wound, so many type of wound. Today we will discuss on that, and the therapy is only same. For any kind of wound, the therapy is same, no difference. Okay, so we go to this next slides. Okay, first we see type of wounds. There are so many types. For example, like when you do the assessment, necrotic tissues, black green wounds. Then we have slab present green yellow wound. There's a slash. Granulating wound, red pink wounds, epithelializing wound, pink wounds. Okay, so all these, most of the wound is non-healing wound. Okay, non-healing wound. So in action plan in a medical industry, they will do a surgical. They have a maggot enzymes type. They got other type also mechanical. They remove, they cut. So many type. They're using hydrogel, hydrochloride. So form, hydrochloride form, and some of the normal things they are doing. This is a standard protocol action plan using, but most of the wound won't work with some of the wound, especially if a deep wound, unless it's a natural wound like you fall down from the car, there's a wound scratch, there's a cutting scratch, that wound will be healed by the body. But the wound is more than a month if never healed, that means that wound need to be looked seriously. That kind of wound, until now, in a modern medication view, they need to cut the wound, create a new cell. Then once they cannot anymore, they cut, keep on cutting. Okay, that's the problem. But it's normal cutting wound. If your immune system is good, it can heal. But most of the wound cannot heal. Okay, that is already high level. So the modern medication view is already past. You cannot use that method anymore. We have to go, we can, but in a ganotherapy view, we can solve the issue. Okay, especially like bed sore wound. A lot of bed sore is happening in a hospital. Why? Because they stay in a bed too long. Okay, and it comes with like a small kind of water small pimples, then end up with a small mold, and it keep on eating up inside. So what the hospital do, they cut the whole things out, and they cut the whole things out, make the wounds to so deep. Then the new wound come out, keep on coming in, because the patient cannot be cleansed. Once cleansed, also no medicine. Whatever cream you put also, it can't heal. That's why a lot of patients are suffering from bed sore wound that cannot be treated. End up you cut. Okay, that's happening now. If you see some more, diabetes wound, the leg gangrene, see infection. Most of the gangrene happen, the blood vessels has been damaged. Arteriosclerosis, okay, the blood vessel damage, there's no supply to that area of leg, and end up the cells in the area that not getting things become dead. Okay, the first you can see we have few type. Okay, autonomic, okay, hot and turgid feet, insensible deformed foot, cold and pale foot, and everything go to a ulceration infection or gangrene infection. These are the things. These are the things is going on currently, and a lot of people suffer from this category, end up with amputation, and no healing criteria. Okay, no healing criteria. But in a ganotherapy, if you see in an early stage, what I mean is early stage, okay, it happened early, you can create it. But in a modern medication view, the amputation only the solution. Otherwise, the cell keep on dying and going up. Okay, that will become a big issue, and it's a death or life situation ready. Okay, in ganotherapy wound care, okay, in the ganotherapy wound care, we have done it in so many years on this category, how to take care of the wound. Okay, what are the solution we give? Very simple. To clean the wound, we use few drops of Jackson body foam, mix warm water, and clean the wound. Okay, after you clean the wound, we apply RG powder to the wound. Okay, we do it 2 times daily. This is a wound cleaning. Very simple, using the body foam enough, because the body foam is created from the natural sources, not chemical. So you won't kill the cells surrounding the wound. Okay, instead it enhances the cell creation. So when you clean with that wound, it's like a Dettol lah. It's like a Dettol, but it's not chemical Dettol lah. Dettol is considered chemical, but this is purely natural. RG, there's more on RG shampoo. They put RG inside, and after you clean it, okay, make sure there's no water inside the wound, and just press with the clean cloth. Press the wound, and once you press up, all the water has been absorbed to the gauze. Then you apply the RG powder. Okay. For oral intake, okay, we can mix codipine 10 ml, vinaigrette 5 ml, 1 scoop of gel powder. Okay, you mix this one. Okay, what codipine will do? Codipine is actually codipine is a cordyceps. It repairs the neuros. It repairs the neuro, and also it balances the kidney to make sure the water is not retained anymore in the body. When the water is not more retained in the body, okay, the the area of wound easily can dry, because if you wet wound cannot dry. So now you have to take care the kidney to make sure urination is all clear, no water retention in the body. Okay, then end up the wound start to dry. Second thing, vinaigrette will open all the blood vessel. Okay, once the blood vessel open, the blood flow direct to the wound will be higher. The percentage of the blood flow into the wound will be higher than normal time. Okay, so codipine will remove the water retention. Vinaigrette will open all the blood vessel in our body and make sure the blood flow will be increased and improved. And gel powder, we add in the gel powder inside it to increase the oxygen into the blood. So your oxygen level in your blood 1.5 times will increase. That means surrounding of your wound, the oxygen will be very high. Okay, once it's high, you mix all this thing, you drink 3 times daily. Okay, then Androgy, we give 2 capsules 3 times daily. Why Androgy need to be given? Because Androgy is natural antibiotic and also natural painkiller and also natural like heat balancer. Okay, so sometimes when the wound is infected, they will have a fever, whatever it is, and to control that, we give a natural antibiotic. We call it Androgy. So the more you can give Androgy, I put 2 capsules 3 times daily. Depend on the situation, you can take 5 also, no problem. You can take more also, no problem. It will cool down the situation of the body. You can balance your pressure, balance your heat, and also control the bacteria inside the inflammation and infections. It will control the inflammation infection in the wound area. Okay, then apply Gano oil at the affected area, massage gently. So surrounding of the area, let's say the wound you already clean up, you put RG powder, but surrounding of the wound you can apply the Gano oil to make sure. Gano oil is like a magnet. It can pull down the blood towards the area. Okay, it can pull down the to the area. So when it can pull down the blood to that area, the wound now, okay, now using codipine, you repair, you balance the water source inside the body, and also it a very good medicine for nerve system. Okay, okay. Then vinaigrette is to open your blood vessel to make sure the blood start to flow directly to your wound. Okay, any blockages in the blood vessels also it will open, and gel powder will top up all the oxygen into the blood, and you can see the wound healing is much faster. Okay, it also depend on the wound type and also immunity type. Okay, and depend on the dosage also. Sometimes people take 3 times daily. Okay, we can see very fast. Sometimes people financially not strong, they take only 1 time per day, so the wound healing will be slower, but definitely it will heal. Okay, definitely it will heal in a long run. You can see a lot of differences in the wound. the wound keep on drying. Later I will show you some of the samples that I have. I got a lot of leg, but today I just pick up few only to show you how the healing has been happened. Okay, we have some testimony I put here. You see how the wound has been healing. Okay, the first things you see, this is the leg area, the first wound in the leg area has been thing like that. The hospital want to cut, but after they come and meet us, we give them we ask them to clean the wound, apply the RG. Then you can see the wound keep on healing. Okay, now actually already healed, but they never come. They already call and tell us the wound is healed. Okay, the second photo here is actually buttock area. Okay, it started from bed sore, then the hospital cut the whole area. After that, the wound cannot heal. You see the wound like the dry, like pus, not clean. So it takes time to heal. After they come back, I give them the RG powder, ask them to clean and give the product to eat. Then you can see the wound start to close down. Okay. And now recently it's already actually closed down to me. Okay. This is actually these two photo, actually the same person. The mother, the lady is mother. The mother is almost 60 plus. But recently, completely, all the wound is completely dry out and no more wound anymore already. And everything is under control now. Okay, this is another leg. You can see the fingers all already like gangrene ready. Okay, it's not too bad already. At least they come and see me as fast as possible. Then after we treat, then you can see the third one very good. Now it's very clean ready completely. You see the new. You can see the finger area all become very new ready. Okay, this is another. This is the gangrene wound is reversed. This is considered they come and see not so worst at all. Okay, sometimes they come and see me with completely damaged ready. It's too late. Okay, once too damaged, too worst ready, then you can't do anything. Okay, you have to no choice to amputate. But if they come as fast as possible, we can reverse it back. Okay, the third one in the leg area, you can see the wound. Okay, this lady, they already told them that they must remove the leg. They want to amputate the leg because this photo on the 13th April, you see 2016, the photo. Before that, they came. That photo is quite bad. I never take. That is, this is after 1 month treatment. The wound start healing. But first, you see the photo. The whole leg has been wounded, and all the water keep on released from this leg, and the leg is swollen like nobody business like that. Okay, and the hospital said the wound never healed for few years, so they need to cut the egg because, and they told that the blood flow, everything has been blocked, and the worst case scenario, they need to amputate the leg. So lucky they come and see me after 1 month, after 2 months, the first photo, then after 1 month, the second photo, then after 2 months, the third photo, and the fourth photo completely healed ready. You see very nice lady the leg. Until now, she's okay. Okay, so this is another cases. Okay, this is another one. It's a diabetes wound, small pimples like sludging coming in, like water. Then they go to clinic and they cut off the whole area. After they cut, they say this wound won't heal. It take long time, but they come and see me. Then I give. So they never go to hospital. Only the first time they go to clinic, they clean up the wound. They come back. Then after we give the whole leg become normal ready. The wound is ready. Okay. And this is like gangrene wound also, diabetes, gangrene wound. And after a few months, you see, after 2 months, 3 months, the wound heal ready. So sometimes it take more time. Okay, it's all take time for wound healing.
The what?
So it's very straightforward. Okay, very straightforward. The dosages that we need to take is only this amount: RG, codipine, vinaigrette, RG powder for the wound, gel powder, Androgy for wound cleaning, body foam, RG powder, and gel Gano oil. These three things. So it's not much costly. I think the most of it, maybe 1 month, you just take around 400 ringgit to 500 ringgit like that. Okay, very small dosage. Depend on the budget. We can work out on that to make sure the wound. Because if you don't take care of the wound, it might end up with amputation. Because I see a lot of people, when they go hospital, they think they can heal it. But this kind of wound cannot be healed by the hospital medication because they don't have treatment on that. The only they can do is amputation. Okay, so we don't have enough wound healing area. Okay. Then there are also another other type of alternate therapies got in the alternative field that can help to inhale healing the wound. So when any patients they come and see me, I will see the worst case scenario on the wound. Then we can give using ganotherapy solution and added together with some other treatment that we can tell. To clean the wound, we'll send to somewhere to clean up the wound. Then slowly we heal back the wound. Okay, that's how the whole system about. Okay, let me stop the sharing. Okay, so today is very quite small, simple wound healing criteria, and I think you all understand a very simple method of healing crisis, how to heal it back to normal conditions. See, every day you must make sure your leg has been cleaned. Okay, most of the people will never clean the leg. When they come back and when they shower, they need to sit down and clean up the leg, all the finger in the leg, because the leg is going all the way around. Okay, you come back, you just wash your face, wash your body, wash your hand, but the feet area, most of the people never look at it. You must scrub it, you must clean it, you must make sure there's no internal inside the wound in the middle of the fingers, both fingers, every fingers, the leg, the toe and the fingers, you must see in the middle whether there's a wound, there's a water trap. You must clean it, all these things, and make sure after you shower, make sure you dry up all your finger in the internal area between the two fingers, the middle within the two fingers. You must make sure it dry. Don't let it watery. Sometimes the water trap inside, it's end up with a small wound and it go bigger and in depth inside. That's why a lot of people got problem by taking care, because they never clean the wound. Okay, and always gano oil. Even though you got a wound or not, don't have wound, doesn't matter. Okay, clean your leg, your feet, and make sure every time you see any kind of bubbles or any kinds of like water trap or any kind of small wound, make sure when you see any small wound, you immediately put RG powder. Okay, it will be more safer to address it in the early as possible. Okay, and sometimes you see a small wound and you not there to clean up, you go to clinic, they make it, they cut, they make it bigger. The next time you go, it bigger some more, bigger some more, end up you're losing your leg. And remember, there's no treatment for that. Okay, if you're taking like diabetes medicine, you're taking some of the other drugs, all these kind of things, you are taking a most hospital medicine lot. Okay, your immune will be low, so chances to healing is very low. Okay, you go hospital, so then most of the hospital end up the day cut off the leg. Why? You go small wound, but they make it bigger because they don't have a idea to treat the leg. So the worst case scenario, they will cut your leg. They will amputate your leg. Why? Because in the first place, I always tell you, never take care of your leg. Okay, if you don't take care of your leg, don't think somebody will take care of your leg. Okay, because you go hospital, it's all amputation is easy, like they cut, it become more worse. It is septic, become more worse, and chances to lose the limb is highest as possible. This is happening in the hospital currently. So as much as possible, when the problem started with small, make sure you clean it. Okay, you put RG powder, and every day make sure before you sleep, take few drops of Gano oil, apply to your leg. Sometimes you can see a certain wound you can't see in your raw eye. Okay, in your raw eye. If you can't see in your raw eye, but it's a small hole that you can't see, the Gano oil can penetrate towards that and try to heal it, especially people getting older. Make sure every day you put Gano oil in your leg. Okay, every day you put. The more you put, the more safer it is. Because guano oil, I see very powerful in terms of healing any type of small wound that started in the. At the same time, you see, if you feel your leg is very heaty, okay, that means acidity is high. Chances to get blister is very high because it's too heaty. The acidity level is high. So guano oil will help you to control the heat. So apply guano oil more, and you can see the things will change. And also do exercise on walking every day. Make sure you walk minimum 30 minutes daily to enhance the blood circulation towards your leg. Okay, and when you sleep, you can raise up your leg a bit higher than the normal position, or you can put a pillow, or you can elevate your what do you call your bed. Okay, when you elevate your bed slightly, maybe 2 inch high, so you can see when you sleep slightly high than your head, then you can see the blood flow to your leg is much better. Okay, the water won't trap at the leg area. Okay, so that's why taking care of the leg and taking care of the wound is very, very important nowadays. I see a lot of people come and see me in the last stage, very pity. I can't help them because it's too late already. We cannot do it. It's totally gangrene and no more flow already. But if we can see people started from the small amount, okay, at least we can help them to save their leg in the future. Otherwise, they might lose their leg. Okay, and a lot of people with small wound also, they keep on going to hospital to clean up. They have no idea to treat the wound. There's no wound care department there. There's no. Okay, in the early stages, get what I tell you, go and buy yourself, treat yourself. That's very, very important to make sure you don't lose your leg. Okay, clear? So any questions and answer? Hope you can follow my ideas, because I've treated quite a number of legs, saved a lot of people's legs. Okay, and please don't tell me last minute. Okay, you have to take care of your leg as fast as possible. Tell your friends, make sure your parents are clear on these issues. Okay, and check their legs. Sometimes the parents, old parents, they never bother to check their leg. We as a children, we have to go and see whether their fingers all clean, there's no wound, anything. If you see any wound, put the RG powder immediately. Open wound, put RG powder. Dry wound, put guano oil enough. Or you can mix the guano oil and RG. But remember, open wound, always RG powder only. Okay, open wound, RG powder. Okay, now we come back to the team. Any questions on these particular things?
Got one question in the chat group by Audrey.
Okay. Norman got stung by crown, slug, moth, caterpillar. Huh? Now a bit swollen and very itchy. Besides using guano oil, all you can do reduce the redness and itchy. Okay. So you can take Androgy 2 capsules 3 times, or 3 capsules 3 times. Take more. Apply Androgy, guano oil, and turmeric mix. Apply to the bite area. Okay, put at the bite area. Androgy mix with turmeric, mix with guano oil, make a paste, apply that area. Okay, then you can see the change. And also you can, if you have what do you call kapo. Okay, the kapo also good lah. The kapo that used for sire one. Okay, the kapo used for sire, because kapo is alkali. Okay, and all this kind of what do you call the sting is actually acidity. So the kapo can neutralize the acidity. So you can mix kapo, mix guano oil, mix turmeric, mix Androgy, all make a paste, applies one like 50 cent size in the area that the bite lah, and the bite area lah. Okay, clear? I think Audrey is still there, or she already left already. Maybe she will understand later lah.
Oh, Doc, Capo is sulfur, is it?
Capo, yes, it's alkaline based lah. You can pull out all the things lah. Any sting by bees, all these things you can apply Capo also.
All right, thanks, Doc.
The sire one, not the Capo Chakuma one.
All right.
The one we makan with sire one, but don't put too much lah. It's also heaty. But small amount just apply to the area and then enough already lah. That will help.
Thank you. Thank
Okay.
you.
Any other questions?
Sabet is in the room. Probably she can highlight the progress of a friend who has blister two days ago.
Hi, Sabet.
She has not responded to me yet.
Okay, no problem. They can update me.
Yeah, I will update with her and I will update next week.
Okay, sure, no problem. Okay.
I think that's all.
But how she's any response with her from you can see any differences with her what after the treatment?
As far as what she told me last night, a bit of improvement on the burn. I have not get in touch with her today lah.
Okay lah, no problem. So just keep in touch and then update me lah. Maybe
All right. I'll do that.
and tell them lah. We can update.
Okay.
Okay, good. Thank you,
All
Sabet.
right.
Thank you.
Thank you.
Okay. Anyone, any questions? Or anyone want to share anything? We can share today.
Dr. Seva, can you hear me?
Yeah, I can hear you.
Yes, okay.
Sophia.
I just want to ask you if we always go leg cream, cream.
Okay.
Do we have to take calcium?
Okay, when you leg cream, sometimes you see our body lack of blood flow. Okay, that's why also we can have a like pain or cramp. Second thing, not enough water in our body also can have leg cramp. Third, lack of sodium. That means the lack of sodium, not calcium.
Sodium.
Sodium.
Oh, not just them. Sodium. Sodium is garam, is it?
Garam, yes.
Garam.
Okay. That also can cause. And the fourth one, sometimes too cold. The environment is too cold. When it's too cold, your blood flow become, your blood heatiness will reduce. This will lead to cramps also. Sometimes you sleep in a cold environment, you can have a cramp. So you have to see what kind of category you are. Okay. But normally in the daytime also you feel a cramp, that means your lack of sodium. So what you can do, you can take like codipine, GL powder, but when you mix with the water, you put little bit of a Himalayan salt, a small pinch of Himalayan salt every day.
Himalayan salt.
You mix it and drink. Then the pain will disappear because sodium is highly utilized for the muscles. Okay, to the muscles. So sometimes most of the people, they have sodium. When they do blood test, they say enough. But every time you have a cramps, that means lack of sodium, the real sodium lah. But in a blood test, you show correct. But reality, you are lacking of sodium because sodium is changeable variable. It will keep on changing. Once you have vomiting and diarrhea, then become low already. Okay, once you don't.
So it's not calcium lah, because
it's
if
not
you
calcium,
said you got,
it's sodium,
it's
it's garam.
Okay.
Okay, so you can take codipine, spirulina.
Spirulina.
Have a natural sodium inside lot.
Yeah, spirulina memang I take every day.
Then
4 in the morning, 4 in the evening. Memang I take every day.
Good. So you maintain that, then should be okay lah. Then apply Gano oil lah. Sometimes the muscle is too tight, too dry. Also, you will have the cramps. So by massaging using Gano oil, also improving the muscle movements lah. Okay.
Because if you go to the hospital, Dr. Seva, they will give you calcium, but I don't like to take calcium.
Nothing to do calcium. Calcium is your problem. The calcium is an antacid drug. Okay, the more you take antacid drug, it won't help you. End up in storage in your kidney and liver.
Yeah.
The best is you take more green veggie and night before you sleep. If you have a lot of cramps before you sleep, you take a one glass of warm water. You put 1 to 2 pinch of Himalayan salt. You mix and drink. Night time before you sleep, a small pinch, 1 or 2 pinch in a small glass of warm water. You just mix it and drink. Then slowly your sodium level will be balanced lah.
Okay. Thank you very much, Dr. Seva.
Okay, bye.
Bye.
Okay. Anyone, anybody want to share anything in a group? You're welcome to share. Any questions? All quiet, huh?
Dr. Siva, I have a question.
Yes.
Raj here.
Uh,
Okay, Dr. Siva, one of my I've given somebody he's a diabetic patient, legs are swollen, but he said at night he feel like cockroaches going around his leg very fast. He said like zoom, 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 the cockroaches going.
It's a blood flow actually.
And
It's a
very
blood
bad
flow.
pains at night.
Huh?
1 hour, the pain is so bad. After 1 hour, then he will relax and he will sleep like a log. He can really knock
Yes.
out. 5 a.m. he wakes up.
Okay. So what you do, ask her to raise a leg.
Okay.
Raise a leg upwards. Okay, that's why sometimes you see when we ask them to raise leg, what they do normally, they will put a pillow. But pillow, after a while, will be moved out. So the leg become normal again. So the best is ask them to raise the, elevate the bed slightly high at the leg area. Maybe you put a stone, a small brick stone under the leg of the feet area, okay, the end and the leg area. You just raise the little bit high than your head. So you can see the bed is slightly elevated. Very mildly elevated enough, so they can see the blood flow is much better. So it's actually a blood flow is not balanced, then might be water retention start to fill. So your blood vessels are filled with the water, so there's no proper blood is inside. That's why they feel like cockroaches running around.
Okay.
Ask her to raise the bed. Okay, that's the bed. So in 6 to 8 hours, when she sleeps at the raised bed, okay, the leg is in this area, the head is in the lower part. Okay, then you can see the problem will slightly go down.
Okay, doctor.
And you can give a vinaigrette mix with the codipine also is good, because you can open back the blood vessels. Vinaigrette will open the blood vessels. It's good for that.
Okay, doctor. Then I'll give him the vinaigrette.
Small amount. Vinaigrette, no need to give too much. Just 5 ml enough ready with a glass of warm water. That is more than enough. Okay, good.
Okay, thank you so much, Dr. Siva.
Okay, thank you.
Okay, thank you.
Doc, we met some patients who are going through chemo and all these things. And we know that when you go through chemo, you always have issues with like stomach pain when you eat, and then the mouth with different taste and all these things. So how do we advise these patients so that they can eat and then, and help to fight the journey?
Good, good. You see, the problem with chemo medicine, when you put a chemo inside a person, okay, for especially cancer patient, it's not only killing the cancer, it's not killing the cancer cells. Actually, it suppressed and arrest the cancer cells. Cancer cell cannot be killed, it only can be arrested by the immune system and keep in a jail. That's how it works. But what will happen? The good cell is dying. Okay, especially your colon area, they got a lot of good bacteria, good cells inside the colon area. So the colon areas start to small intestine, especially absorption area, and also stomach layers. So when you don't have, when your layer has been killed off, the cells in the layer has been dead because of the chemo reactions, the chemo chemicals, drugs that will damage the liver, damage the digestion part. I mean your stomach, your liver, your pancreas, your small intestine. So this will cause a lack of enzymes. Okay, lack of enzyme, especially like the digestion enzymes. Okay, acid hydrochloric, all these things is been imbalanced in your stomach area already, because the functional system is not functioned properly. So for this kind of patient, they have lack of appetite. The acid will go up and they don't feel to eat. Whatever they eat, they will vomit, because whatever they eat is not digested in the stomach. When it's not digested in the stomach, what will happen? In a long run, the patients start to vomit because the food is pulled out from the body. Okay, it's same thing like people know chemo. Sometimes you go and eat like bad food, okay, some spoiled food. The moment you go, after half an hour, you see you vomit out. That means the body has their own immunity system to reject certain things that not clean. Okay, when your stomach is not clean, when the stomach got problem, the cells in the stomach cannot release correct enzyme to digest the food. The food become poison immediately in your stomach. Then end up with vomiting, end up with no appetite. Okay, so this, when they don't eat, they don't have energy. So to solve this problem, the best is to help this person is actually enzyme. What kind of enzyme we can use? Morenzyme. Morenzyme is very powerful because it has prebiotic and probiotic inside. When you take probiotic and prebiotic inside the stomach, when you send the bacteria inside, the stomach still, the acidity stomach automatically become alkaline. And whatever you eat, you'll be refreshed again, and the digestion will be completed, and absorption, you can go to the second level. Patient who take a lot of chemo, when they get chemo, the first stomach layer is damaged, the second layer is damaged. So the food cannot be digested and sent to the second level. That's why they got problem. End up they are losing weight because there's no absorption level, second level processing. The first level damaged because then they don't want to eat anything because the first stomach is keep on rejecting the food. Okay, so in the long run they can lose their weight and they become very weak. So Morenzyme and GL is playing a big role because GL consists of more than 400 type of bioactive elements such as polysaccharides, adenosine, what do you call this organic germanium, okay, tryptophanes, and also almost vitamins and mineral, full range of vitamins and mineral. Okay, these are natural things, the vitamins, mineral, naturally using the enzyme to support, push into your body. When this one is pushed into your small intestine towards your bloodstream, at least you got some food to balance. That's why it's small amount, when you take a small amount Morenzyme and GL, your body become more active. And slowly, the body, when active, it has energy to digest now. Okay, you must remember, if you don't have energy, your food cannot be digested, because if you want to digest, you must need the energy. Okay, that's why people who are in starvation, you see people are starvation 2 days, 3 days, no, never get food. The moment you give food, they cannot eat. But you must give them an enzyme, juices, whatever it is, just give them juices first. Once the juices enter the body, the fluid enter the bloodstream, they have energy now. When they have energy, now whatever food they eat can be digested, because body need energy to digest the food. If you don't have energy, you need to give energy first, then digestion secondly. If you want to push the food direct to the people that who don't have energy, the energy already taken by the chemo, then finish lah. Whatever you put also you vomit out lah. Okay, that's why GL and Morenzyme playing a big role to enhance the digestion criteria, to enhance the enzyme criteria, to enhance the breakable, the food breakable into small particles and absorption level, to enhance the absorption level from the small intestine. It's all done by the prebiotic and probiotic from the Morenzyme, and this will mix up with the GL powder with 400 bioactive elements, will absorb to the bloodstream. Okay, then now you can give a soft food lah, maybe a porridge, small amount milk, all this thing, bread, all this thing you can start to give, but you must get the energy first. Okay, okay, Serena.
Yes, doc, but what about your mouth? Because you will lose your taste, right?
Yeah,
so to get your...
You see, your mouth, okay, anything happen to your stomach, the acid will reflux back to your mouth. So once you alkaline back your stomach, your bacteria is good, automatically your saliva change, because saliva is taken from the internal system towards your mouth. It's come from your digesting system. Your saliva actually taken from your digestive system, come back to your tongue. It's taken from there. So if I take the bad one from the stomach acid high, your mouth also feel acid because you are taking something from your stomach towards your mouth. That's why what happened in the stomach will happen in the mouth. If your stomach is clean, good, your stomach also got appetite to eat. If your stomach is bad, you don't have an appetite to eat because it's all taken from your stomach towards your mouth. The saliva actually activating all these things activated towards your mouth. That's why when your stomach got problem, you don't have appetite to eat, your mouth smelly. Your stomach problem, mouth smelly. Your stomach clean, mouth no smelly. So this is all link each other. Okay, that's why the enzyme playing a big role. Mouth and stomach is the two places that can absorb enzymes. Okay, you must balance your stomach, then automatically mouth will balance. So if you feel like your stomach like that, you can that's why you can mix the more enzyme and the GL. You can gargle. You can do two things. The more once you mix it, you put sip by sip, put in your mouth, gargle it, mix it your saliva and swallow it. So this will help to cleanse up the stomach and increase the enzyme in the stomach. Okay, then slowly will change.
Dosage of the prescription,
dosage actually mostly you see the patients. If the patient is quite weak, maybe you can give a small dosage. Okay, maybe as I told you, like 10 ml more enzyme, 10 ml small amount, because you cannot give too much of water. This kind of patients, small 10 ml of warm water, 10 ml of more enzyme, 1 capsule GL you put inside, shake, 1 sip, gargle in the mouth, swallow. Wait for 20 minutes, 30 minutes, another dosage. Then we wait and see. If they feel hungry, they will ask for food. When they ask for food, you give a soft food. Okay, after they eat, 30 minutes, you give another dosage. Because the food they eat, they must have an enzyme. So the next 30 minutes dosage will help the food, the porridge to digest. If they vomit out, doesn't matter. Give the third, keep on to give the third dosage, then fourth dosage. Come to fifth dosage, they must be hungry again, they will ask for food. The second food they take, no problem. The first food might be they vomit out because the first time a lot of acid inside, all the junk inside, so you vomit out. But after they vomit out the first time, that means the colon become clean ready, the stomach become clean ready. So the fourth dosage and the fifth dosage can help them to bring the good nutrition again to the system. That's much better lah. So that's why we have to monitor closely. First 3 hours, we see the conditions, then we monitor plus another 3 hours. If the first 3 hours they are okay, they can eat, no vomit, then they are okay already lah. Then you can give the dosage 3 times per day, enough already lah. To make sure the enzyme level is keep on in the par lah. Okay? Clear?
Yes, doc. Thanks, doc.
Okay, good. Okay, so more 1 hour already. Very fast. Just talk little bit, also more 1 hour already. Okay, any questions?
Sabet here.
Yes, Sabet.
Lately, these 2 nights, I have eye back.
Okay.
What happened?
High back.
Yeah, eye back.
That means you don't sleep enough. You don't sleep enough. If you don't sleep enough, your eye become very tired. When your eye become very tired, okay, when your eye become very tired, the water in the eye will drop into your eye bag. So you can see like swollen eye. That means you don't have enough sleep. So what you can do, today night, you take Gano oil, take 1 drop, 2 drops in the right, 2 drops on the left, just massage the eye and just close your eye and sleep. Then you'll be okay. Okay? Okay,
all
Sabet?
right.
Good.
Thank you.
Okay, good. So if you don't have any other questions, we will end up the session today. And the next session will be when, Selina?
Next session is actually second